My name is Dr. Oliver Schumacher. I'm a German board certified plastic surgeon, trained in Germany. I was also a fellow at Yale University for research purposes, and I'm a DHA licensed consultant for plastic surgery here in wonderful Dubai. Protruding ears and hereditary ear deformities are very common. Actually, they are the most common deformities, hereditary deformities that we find in the head and neck region. Therefore, we have young patients, mid-aged patients, and old patients that seek our help and visit our clinic.
What is the Vector method and what are the special advantages compared to traditional techniques?
The Vector method is the minimum invasive method that doesn't require the excision of cartilage. It doesn't even require an incision. It uses so-called vector methods, sutures that act like an implant that is inserted into the ear cartilage to reshape and reposition the ear cartilage. The advantage is we are able to produce very natural results that are very stable. In fact, with traditional methods, it's always necessary to wear headbands for up to 6 weeks after the operation because the ear gets weakened after these very aggressive procedures. With the vector method, there's no need for bandages, no need for any kind of dressing. That's the main advantage for the patient. For me, it's not only the scar, it's the aesthetic outcome that is superior. At least that is what I think. That is why we established this technique 15 years ago. We treated over 8,000 ears, so success speaks for itself basically. The surgery is performed under local anesthesia in an outpatient care setting, so the patient can leave the clinic after the procedure without any dressings or headbands or anything like that. In fact, the patient can actually assess what we are doing while we are doing it because we allow the patient to have a look in the mirror like 4 times during one operation. That makes it easy for us to find the perfect position and the perfect correction that the patient demands. This technique requires no incision, so there's no scarring. We have little punches that we use to insert the sutures into the ear cartilage. They're usually smaller than 1 millimeter, so they heal within 48 hours. So this patient was not basically established for the correction of aesthetically unpleasing ears. It was established for the correction of hereditary ear deformities. So 99% of the deformities, not only protrusions, can be corrected. And what the patient can expect is a very natural result. There's basically no limit in the correction of the protrusion, but our aim is to produce very natural results. So I personally don't like to overcorrect ears, although it's possible. Although the procedure is minimum invasive, it still involves the whole cartilage of the ear. Therefore, there will be swelling and bruising for 5 to 7 days. But there's no bandage and there's no dressing, so the patients can basically go back to work if they want to after a couple of days, but there will be pain that needs to be addressed with painkillers for at least 24 to 48 hours. Regarding like sports, I would recommend to skip the gym for a week or at least 5 days. A minimum invasive ear correction with our vector method costs around 28,000. We have a lot of unilateral cases, that's in the region of 18,000. Actually, the correction of hereditary ear deformities and protruding ears is not an easy procedure. It's one of the most difficult procedures in the head and neck region regarding aesthetic procedures. Always underestimated, and therefore we have a lot of really bad results, especially with traditional methods. That is the reason why we established our technique almost 15 years ago. We've been dominating the market, so to speak, for minimum invasive correction of hereditary ear deformities and protruding ears in Germany for over a decade now. And we are actually reproducing what we've been doing in Germany and also in Saudi Arabia. So to my mind, it absolutely makes sense not to have an open procedure, but to have a vector method performed if required.